This video is going to walk through the background of CNY HMIS and cover some very important HMIS terms and vocabulary. So what is HMIS? HMIS stands for Homeless Management Information System. It is the system that holds all of the HUD data standards for all data entry across multiple federal partners and multiple project types. All projects who enter data into HMIS must serve individuals or families who are currently homeless or at risk of homelessness within your continuum of care. So this is a list of HMIS organizations and agencies that are located within our HMIS. We have a 2 continuum of care HMIS implementation. So there's 2 COCs that operate within the HMIS. The first one is New York 505, which includes all agencies and organizations in Cayuga, Onondaga, and Oswego counties. The second COC is for New York 510, which includes all agencies and organizations located in Ithaca, Tompkins County. So why do we use HMIS? We use HMIS really to improve and increase continuity of care. Within an HMIS, we have multitudes of organizations and projects. This allows for really great care coordination with open visibility, so you can see what agencies and organizations or clients are being served at, so you can hopefully reach out to that agency and get a release of information to contact them and really do some in-depth, quick, fast care coordination. The second reason is for fast information sharing. So decades ago and even farther than that, in order to communicate or even know if a client is also being served in an agency, first the client would have to tell you and divulge that information that they are working with an agency, and then sign an agency release of information for you to talk to that person at your agency, and also sign another release of information at the other agency for you to do care coordination and case conferencing and really work together as 2 separate providers providing service to this individual. With HMIS, it allows for immediate information sharing with an open system. So if a client signs a CNY HMIS release of information at both agencies, each agency can see that that client is being served, and it can kind of move things along quickly. Having open visibility with certain data sets within HMIS, like the case manager section, you can identify who the case manager is at that organization and have the contact information for that person. You can also, some agencies allow the case notes to be shared and visible. This also allows information to be shared quickly so that each agency staff person knows what's going on and the goals and the stuff that the people are engaging in with each individual service. And it also provides an accurate community level information sharing. It allows us to pull information into reports, to identify gaps in needs and services. It allows for us at a higher level in other organizations to be advocates and active advocates about community planning. Really, what is the system looking like? How is it operating? How are we effectively serving those who are experiencing homelessness or at risk of homelessness? So it allows us to see those gaps and needs and do some really great data-driven community planning. So we have some a user ethics form that every user must form when they are signing up to use HMIS. Some ethics we're going to cover in this training. Number 1, protect your password. So do not leave your password written. Don't leave it saved on your computer. Don't put it on top or underneath your desktop. Really make sure you're protecting that password as much as you possibly can. We only allow 1 profile per person. So if a user has or needs access to multiple providers or different agencies within HMIS, that person only has 1 profile, and that 1 profile holds all projects within HMIS that they have or need to access. Number 3, do not leave HMIS open. If you walk away from your desk, log out of the system, Again, don't leave it open where people can see it. Don't allow other users to use your login information. Again, don't save your passwords on your hard drive or on your desktop, especially if you're sharing a desktop with another agency staff. Make sure that you don't allow other users to use your login information, your username and password, because if there is something like ethics violation, it will be led back to you and your license. And lastly, don't look people up in HMIS unless it's your job to do so. So unless that person is seeking services at your organization or your project, or if you've served that person before and you're doing some data cleanup, or you're actively serving them in a project, make sure you're not looking up anybody else outside of those and your job descriptions within HMIS. So now we're going to cover some key HUD definitions and terms. These definitions are identified through the Department of Housing and Urban Development, otherwise known as HUD. So the first term we're going to talk about is what is literal homelessness. So when you're answering any question within the HMIS system for a project that's serving people who are experiencing homelessness, this is the definition you're going to use. So number one, they have a primary nighttime residence that is in a public or private place not meant for human habitation. Number two, they're living in a publicly or privately operated shelter designated to provide temporary living arrangements, which includes congregate shelters, transitional housing, and hotels or motels paid for by charitable organizations or federal, state, or local government programs like the Department of Social Services. Number three, they're exiting an institutional stay like jail or a hospitalization or inpatient rehab where they have resided for 90 days or less and who resided in an emergency shelter or in a place not meant for human habitation immediately prior to entering that institutional stay. And four, the individual or household is actively fleeing a domestic violence situation. So it's really important when answering these questions in HMIS surrounding homelessness that you do not count any time that a person or a family is either couch surfing or living in a doubled up or temporary living situation. That is not covered under HUD's definition of experiencing literal homelessness. There's another definition we're going to cover around chronic homelessness. So chronic homelessness, back in 2016, HUD gave it a very specific objective criteria and definition. Number one, the individual must have a disabling condition. That disabling condition must be of long continued and indefinite duration that substantially impairs their ability to live independently. And they had to have been continuously homeless for a year, 12 months or more, or they must have had 4 episodes of homelessness in the last 3 years, and those episodes must add up to 12 months or more. There's another data element that is located within HMIS for almost all entry assessment forms, which is called the approximate date homelessness started. This is really counted. HUD is trying to really get at when was this current episode of homelessness and when did it start. So it's counted from the last time they were housed in either a temporary homeless or a temporary situation for more than 7 days or in a permanent homeless situation. So that could be doubled up is temporary or it could be permanent. So that when is that current episode of homelessness? When did it start? So when does an episode of homelessness end? So it ends or when there is a separation of 7 or more days in a permanent or transitional housing program, or it's separated by more than 90 days in an institutional stay. So an example of this would be if a person was staying with a family member for 2 months, that's considered either a permanent or transitional housing situation. And if they walked into an emergency shelter today, they were in a permanent transitional housing situation for more than 7 days. So today would be their approximate date homelessness started. The same thing for institutional stays. So if a person, even if they were in a homeless situation prior to that institutional stay, if they were there for 91 days or more and they walked into the homeless shelter today, that's considered, today is considered the beginning of their current episode of homelessness. So the approximate date of homelessness would be today. Okay, so now we gotta stop that.